I'd like to introduce clinical hypnotist Lachlan Cox, who's originally from Australia but is now living in Portugal. Thank you for joining me, Lachlan.
Well, thanks so much, Linda, for having me.
Now, I've had the pleasure of meeting you and finding out about what you've been doing. Could you tell us how you got into hypnosis?
It's just a regular story, but basically what happened was, in my time, I was living in Spain, and I was going through a bit of a rough period in my life. I'd just broken up with a long-time girlfriend at the time, and all my family was in Australia. I was the only one living abroad at the time, and basically I didn't want to burden anyone with my troubles, so I started to look for ways that how I could help myself, how I could actually recover, my mental health, I guess you could say, or even my emotional state. And I started looking online at the time. This was back in around about, I think it was 2006, 2007, and I found a doctor in the US that had written a book it was on self-hypnosis, and decided to buy it, and that came with strangely enough, still in 2007, he was still selling cassette tapes. And basically I took that, read through the book and was listening to the tapes, and pretty much from in the first couple of days I already started feeling the change with me, just the way I was paying more attention to myself and how I was more involved on the inside, of myself, instead of focusing on what was outside of me. For external stimulation, I was looking for it internally. Mm-hmm. And it helped a lot. Then after, some time, I thought, well, how can I actually take this? And in the beginning, it wasn't how can I turn this into, helping other people. It was actually, at the time, I was doing sales, and I was kind of wondering how I could take it to increase my communication, and how I could take it, to help my sales, basically. And so I started to learn a home study course by a very, very highly skilled conversational hypnotist called Igor Ledachovsky. And I was just training his home study training for a couple of years, and then I got to a point where I actually wanted to help people. I was tired of I don't like the idea of using hypnosis, in the wrong sense, in taking advantage of people, and in that kind of regard. And I actually found out, I found more. I felt better if I was helping people with it. And actually, Igor at that time was doing a hypnotherapy training course for 6 or 7 days, and so I signed up for it, and I went to do it. And that was, I think it was in 2011. Basically, what I did from there on was I haven't stopped. I've just wanted to, help people. I dropped out of the sales that I was doing, and I started doing hypnosis full time, for helping people with problems.
Mm-hmm. Now, hypnotism gets a bad press with stage hypnotists, people clucking like chickens and so on.
Singing like Elvis.
Exactly. I mean, I was first introduced to hypnosis by Dr. Tom Gilhooly, and it must have been back in 2005, probably. And amazingly, I got to travel with hypnotist Ted Heath, helping to treat patients with MS and amongst other conditions. And it was amazing how when we're sick, we train our brains to think we can't do things. We can't lift our feet. We can't control our bladder, things like that. And under hypnosis, Ted was able to help these patients to actually learn to take control. So I see it as a way of reprogramming your brain, helping the people to overcome their obstacles, which is just fantastic. It's no stage trick. It's nothing scary. I've been hypnotized many times myself. Also been hypnotized by you, I must add. Could you explain to people how you go about hypnotizing people?
How I go about it? It just starts off as a conversation. I really, if I'm working with someone, I want to know why they're motivated to want to get help. Once we establish what that motivation is, then I look for through a conversation, I'll just talk to them, kind of analyze them. I've also studied microexpression. I've also done microexpression training. So I kind of study the person's face and what they're thinking, what their reactions are as well, so I can kind of analyze them and really get to the root of the problem, just in a conversation first off. And then through that, either using their imagination or, just following on the conversation, maybe through challenging questions, maybe through, anything that challenges the person to really think on the inside instead of, looking for answers outside. I'll really challenge them to find their own answers. And it actually makes a lot more sense than, from my point of view anyway, I mean, it makes a lot more sense to force the person to find the resources inside of themselves, which will then create a permanent, like you say, a reprogramming. So if the person has been doing something, a habit for a very long time, well, what they need to do is learn to unlearn it and then learn how to do something else that's better for them. So basically what I do is I need to talk with what is the subconscious mind or the unconscious, which is where we do all of our, where we have all of our base learnings. So if we learn to drive a car, for example, initially when we get in the car, consciously we have to be aware of everything that's in the car and how it works, with the pedals, with the indicators, with the steering wheel, the mirrors. And, the first time you get in a car, it's quite overwhelming. It actually, it's an overload of information. And that depends also as well. If you're in a manual car, then you've got the gears added to that. And that overload of information is because, we're thinking about it consciously. But over time, the more we do it, the more we practice it, we become more natural at it. We can pretty much put it on autopilot. Once we start to drive, everything just becomes natural and automatic. And at the same time, we can think consciously of doing other things. Why am I saying this? Is because basically you need to, for helping people with problems, or say helping, to find their motivation, is first to consciously be aware that there's a problem, is the first step. Then secondly is to actually help them with that problem at an unconscious level or a subconscious level, which is where we learn to do everything naturally and automatically. So then I'll work with the person at that level so that then later on they can consciously do things naturally because they've relearnt or they've reprogrammed that information that was causing them the problem, if that makes sense.
Mm-hmm. And how often would somebody have to be hypnotized to reprogram themselves?
It can depend. It can be. I've had conversations with people where I've just said a single phrase, and it wasn't a regular conversational phrase, but it was a phrase enough to challenge their perception of what they were thinking about, and that was enough to actually, create a change inside. So it can be anywhere from a sentence to, maybe 2 or 3 sessions of, like 2 hours each session. So it actually depends on the person that, is needing the help. It's kind of hard to kind of pinpoint, but I mean, I've gone anywhere from even just to give an example of, like stopping smoking. I mean, I've done sessions of stopping smoking that have lasted maybe 50 minutes, and then I've done others that have lasted 4 hours. So, even on a single problem, it can also depend on the person. I think that's kind of what I'm trying to say, is that, even on a single problem, you've still got to work with the person on their issues. It can't be generalized.
Mm-hmm. And I understand that you can treat people over the phone or Skype.
I actually have done that a few times. I've actually done that when I first came off the course. When I first learnt hypnotherapy, I actually one of my friends was actually in a depressive kind of state, and as I was driving home, it was about a 3-hour drive. As I was driving home, I was just talking to him every now and again and over the phone. And each time I talked to him, I could hear him changing slightly, but he wasn't sure why. And then when I got to his place, we had a chat, and and that actually changed. But yeah, I've done consultations over the phone as well as on Skype as well, and then face to face.
So where I'm going with this is that if anybody has a problem that they think hypnosis could help, providing they've got access to a telephone, you would be able to potentially help them.
Yeah, for sure. Because the thing is as well, a lot of people think that, you need eye contact for hypnosis, but really what you just need is the other person to be aware and just be listening, and to be paying attention to, to the conversation. That's pretty much what you need.
Mm-hmm. So if somebody wanted to find out if hypnosis was for them, would they be able to discuss it with you first before actually having to pay anything?
Yeah, for sure. I'd be more than happy to have a brief conversation with them, to see what they're looking for, maybe put their mind at ease if they're a little worried about what hypnosis is or what it does, or or to see if what I can do can actually help them. So yeah, for sure, I'd be happy to through email, through a telephone call, through a Skype call. I'd be definitely happy to have a chat with them.
And if they decided to go ahead, what are your fees?
My fees are, well, I'm in Europe, so I'm going to talk in euros. My fees are for a 1-hour session would be 50 euros, and then for a 2-hour session would be 100 euros. Generally, in a first session, I would go for 2 hours, just so it gives us time to be able to talk a little bit in the beginning, and then also work, without really thinking that, we only have an hour. So, normally in the first session will be 2 hours, and then after that, we can see if it's only necessary 1 hour or if it's only necessary that one session. So that's the fees.
Mm-hmm. Okay, so if people want to find out more, we have a section on hypnosis on our website and on our forum, so people be able to actually go there and find out your telephone number, your email address, and your Skype name.
My Skype address,
yeah,
exactly.
Okay, and if anybody wants any further information from me, they can click through from this YouTube video. So thank you very much for joining me, Lachlan.
Linda, thank you so much. It was an absolute pleasure.